Hello everyone. Today I will be looking at the development and eruption of permanent teeth, and specifically we'll be looking at the calcification dates, the crown completion dates, the, the root completion dates, the eruption or emergence, and finally we'll be looking at the sequence of eruption of permanent teeth. So this is the comprehensive chronology, and we'll be looking at different aspects. We'll be starting off with maxillary teeth, followed by mandibular teeth, and then these are the 5 areas that we will be looking at. The first thing is calcification, followed by crown completion, and then eruption or emergence sequence, and then the root completion, and finally the order of eruption. So this is the first aspect that we're looking at. It's the calcification chronology. What we need to know is that although there can be some variations in the eruption pattern of permanent teeth, but their calcification usually follows this schedule. The first tooth to calcify into the oral cavity is the first permanent molar, and the first evidence of calcification seen at the time of birth. It's the same for the maxillary and for the mandibular molar. Now it is followed by the central incisor, which is around 3.5 months, the lateral incisor around 1 year, and the canine. So within the first year we have the first molar, the central incisor, the lateral incisor, and the canine. Then the first premolar and the second molars, they usually calcify at 2 years of age. And then we have the second molar that usually calcifies at the time of 3 years, and lastly the third molar, which calcifies at 9 years. Now, how can we possibly remember all of these calcification dates? Do we have any way of remembering them? So this is the way we can actually remember them. So from birth to 1 year, these are the teeth that are actually calcifying. So it's first molar at the time of birth, central incisor around 3.5 months, canine, and the lateral incisor. So all of these, they are calcifying from birth to 1 year at different time points. Now for 2 to 4 years, we have premolars and we have second molars, and then finally at 9 years we actually see the third molars being calcifying. So in radiographs, the first evidence of calcification of third molars is usually seen at 9 years, and before 9 years it's very hard to predict whether the teeth will be forming, whether they will be mineralizing or not. Now a quick question: which tooth replaces the last primary tooth to be exfoliated? So the last primary tooth to be exfoliated is the maxillary second premolar. I hope you had predicted this. So we'll carry on with the crown completion chronology. So the crown is usually completed of the first molar at around 3 years, and the rest, the central incisor, the lateral incisor, around 4.5 years. The same is for maxillary and mandibular. The canine is around 6.5 years, while the premolars are around 5.5 to around 6.5 years. The second molar around 7.5 years. So what we need to know is that the tooth erupts into the oral cavity when the whole of the crown is completed, along with 2/3 of the root. So this is the point at which emergence or eruption takes place. So now once the crown has fully formed and 1/3 of the root has been formed, then it actually erupts or emerges into the oral cavity. So the first tooth to erupt into the oral cavity is the first molar, and then it is followed by the central incisor, then the lateral incisor, and the mandibular teeth are actually emerging or erupting earlier than their maxillary counterparts. So now we have the root completion chronology. The root usually completes around 2 to 3 years for the anterior teeth, and for the posterior teeth it takes around 3.5 to 4 years after the crown completion. So once the tooth has been erupted into the oral cavity, it takes around 2 to 3 years for anterior teeth, and for posterior teeth it usually takes around 3.5 to 4 years. So the root has not fully formed when the teeth emerges into the oral cavity. So this is the order of eruption or the sequence of eruption. So we have this is for the maxillary teeth. So the first tooth to erupt into the oral cavity is the first molar, which is followed by the central incisor, then the lateral incisor, and then we have the first premolar, which emerges into the oral cavity, and then the second premolar. So the premolar that erupts first into the oral cavity is the first premolar. It is followed by the canine, and then we have the second molar, and then the third molar. So the main aspect that needs to be considered here is that the canine erupts after the first and second premolar in the maxillary arch, while in the mandibular arch, all of them, the sequence of eruption remains the same except for the canine. In the mandibular arch, the canine erupts before the first and second premolar. So it is the earliest canine that erupts into the oral cavity. So now we are combining both the order of eruptions of the permanent teeth. So, and this is how it actually looks like. The first that erupts into the oral cavity is the mandibular first molar, which is followed by the maxillary first molar, and then we have the central incisor, mandibular central incisor, and the lateral incisor, followed by the maxillary central and the maxillary lateral. Now, once this has been accomplished, so the first premolar that usually erupts is the maxillary first premolar, and then we have the maxillary second premolar, and then we have the maxillary canine. So now we'll be looking at some pictures from Schober and Messler's atlas of age determination. So this is how it actually looks like in a 7 or 8-year-old child. And some parents, as you can see, we have the permanent first molar that has erupted into the oral cavity, and they are in occlusion. So some parents, they mistakenly believe that the permanent first molars are actually deciduous teeth because they are erupting posterior to the second molar, and it is a mixed dentition, but they since they cannot discern the permanent teeth from the primary teeth, they believe that it is a milky tooth or it is a deciduous tooth. So by the age of 8 years, as you can see, the first molar has erupted into the oral cavity. Then both the central incisor and the lateral incisor are erupting at different aspects. So at this stage, what usually happens is that there are spaces in between the anterior teeth, specifically the central incisor and the lateral incisor, and the canine has not yet erupted into the oral cavity. So this stage is known as the early duckling stage, and the reason why it's early duckling because of the spaces in between the maxillary incisor and the lateral incisor, it looks unesthetic or ugly to the viewers. So by the age of 10 years, what happens is that the primary second molars are evident, but the canine has still not erupted, and the canine usually erupts once both the maxillary and mandibular first premolars have erupted into the oral cavity. In the maxillary arch, the canine usually erupts when both the premolars have erupted into the oral cavity. Now, this is the picture taken from Schober and Messler's atlas, and this shows the 11 and 12 years of age. So by this time, all of the primary teeth have now been exfoliated, and second molars, they usually erupt at the age of 12, and they are also known as 12-year-old molars. By the age of 21 years, all the teeth have erupted, and the dentition is now considered to be complete. Now, some clinical considerations. Tetracycline staining is a staining which is historically seen in the Pakistani Indian subcontinent, and this was primarily due to the intrinsic staining of the teeth caused by this antibiotic, oxytetracycline, or OTC as it is commonly known in this part of the world, was usually, and if it was administered to children, below 8 years of age, what happened was that it used to stain uh, not only the teeth but all of the calcified structures during the formative stages of tooth development. So all of the teeth that were forming during the first year of life, or whenever the, the antibiotic was prescribed, we could actually see these staining, and these stains were intrinsic. They wouldn't go out. They wouldn't go even if you. They were from the inside of the tooth. Okay, so any children below the age of 8 who are receiving long-term or short-term therapy with uh, oxytetracycline, they develop these brown discoloration of teeth, and this drug actually deposits in the teeth through the formation of a complex, which is known as a calcium orthophosphate, and this discoloration and this staining is permanent. That is why recommendations are that to avoid giving oxytetracycline to pregnant women and children under the age of 8. Oxytetracycline is a good antibiotic which is given for upper respiratory tract infections, and it is cost effective, cheap, and it actually helps in combating this upper respiratory tract infection. But due to its brown discoloration of teeth, it has largely been discontinued. And that is all for now. Thanks for listening.